Back to East Texas Live on KETK.
Welcome back, everybody. Dr. Doug Hodde here from Trinity Mother Francis to talk about vaccinations. Not necessarily the flu vaccine, although we certainly recommend you get one. Nice to have you with us, by the way.
Pleasure to be here.
I know you're hoping a lot of this vaccine talk right now. Everybody's thinking about flu vaccine, getting it, get the flu vaccine, get the flu shot, make sure you're okay for the season that we're in right now. But also, it makes you think about vaccines that us grown-ups might not normally think about. Right?
Correct.
We think about vaccines in children, but we get left out on a lot of these things.
Yes, in the United States we do a good job of vaccinating our children. The schools require it, and as parents we tend to do a great job of that anyway. But we tend to ignore ourselves, and there's actually, the CDC recommends a dozen different vaccines in different adult populations. It's a little complex which ones for who, but in general I do see vaccine preventable disease on a fairly regular basis, I've seen true tetanus a number of times, and I see quite a lot of flu from people who skip their flu shots. The pneumococcal vaccines are a wonderful immunization that can prevent a lot of morbidity and a lot of disease. As a family doctor, and I think I speak for all family doctors, we would much rather prevent a disease than treat it, and we tend to be very focused on wellness. But I'm trying to encourage people. Most insurances now pay for an annual wellness visit, and I want to remind people to sit down with their family doctor and discuss some of these vaccinations and see what they qualify for, what they need, and what they're at risk for in their population. For example, the pertussis is something that a lot of adults may have had at least some immunization to, but we're trying to revaccinate that population in order to prevent the transmission of that disease to the small children, so you can protect your smaller children, your grandchildren, by having that vaccination.
We know that as the whooping cough, is that right? Or?
Yes, sir. Yes, the whooping cough, and that typically comes as a Tdap. So we get our tetanus vaccination, and they're recommending at least one of those during the adult age years to do that. I generally tell patients, when you get even the smallest laceration, come on in and let's get you immunized for that, so that we can get that taken care of.
So just because you had these, I had that when I was a kid. That nothing lasts forever, and that includes a vaccine.
That is correct. Also, although most adults have had varicella or chickenpox, in some populations, if it's not clear that you've had it, they like to go ahead and revaccinate them so that they're not transmitting that. And then later on, in later on age groups, we're really pushing the Zostavax, and I've had a number of patients with shingles, and that's a very painful disease, and I can guarantee you every one of them would pay full cash price to have that vaccination rather than go through the discomfort of the shingles.
Now, other than awareness, is there any reasons why people don't tend to get all the vaccinations that they need?
Oh, I think we're human beings, and I know all us crusty old men, we tend to think we're a little immortal, and
I'll be fine.
Yeah, I'll be all right. And then mothers are my favorite population on the planet, because they will bring their kid the second time they cough, and they will have a frank pneumonia and still be trying to tough it out on their own.
Yeah. So a mother's health is usually on the bottom of the list, especially for you moms.
But even for the healthy people, would you say get your vaccinations?
Yes, and you really need to sit down with your family doctor and look at the table of vaccinations and what's available for you, because different populations, for example, people who are immune compromised, and that may include diabetics depending on how severe your diabetes is, but certainly patients who are at risk for HIV are immune compromised, and there's certain vaccinations that they really need to have. Also, some people with heart disease need more vaccinations. I tend to worry a little bit about my older population. They just don't have the immune system that they did when they were younger, and although they're in their 65 years of experience, they've never gotten pneumococcal disease. That they're at risk as we get older.
Guys, prevention is key here. Vaccines are part of that line of prevention. And again, see your doctor, talk to him about that, because there's so many things that you and I are no longer 10 feet tall and bulletproof. So it's time to go into the doctor and get it checked out. Dr. Hodde, thanks for coming in.
Thank you, Doctor.
Thank you, man.
We'll be right back.